Yay, this is what we need to do. Um, I would love for us all to start with just a little breathing exercise. Maybe this is for me, but I want it to benefit all of you as well. We're going to do something called box breathing. And so, what we're going to do is we're going to draw a box. And as we draw that box, we're going to change our breathing. So, as we draw up, we're going to inhale. And then as we draw across the top, I want you to hold your breath, exhale down, hold your breath across the bottom. Good. Let's do it again. So we're going to breathe in, hold, exhale, hold. One more time. Breathe in, hold, exhale, hold. Good. Thank you all so much for just taking those few moments to breathe. I think that might be one of the most valuable skills that you can take away. Breathing is the fastest way that we can help ourselves when we are feeling frustrated, stressed, anxious, nervous, whatever it might be, from this sort of place to a place of more calm and peace. And I think we operate better as humans when we are practicing from that place. So please, we're going to keep finding these exercises for ourselves, but breathing is a really quick way when we don't have loads of time to help us kind of find that calm and that peace. So thanks for doing that with me. Uh, so yes, as Andre mentioned, Project Present's mission is to really improve the quality of life for older adults, care partners, professional caregivers, and individuals living with Alzheimer's disease and related dementias. So we strive to improve communication, really kind of enhance connection, cultivate creativity, and promote joyful collaboration. And we do this through really 4 different types of programs. The first one we offer are dementia and communication trainings. So we do this for professional caregivers, for caregivers whose spouses are living with dementia, or adult children, anyone that's really wanting to learn more about sort of brain diseases, and then how do we communicate effectively with someone living with changes in the brain. We also, our second type of programming are caregiver immersive programs. So this was something that we used to do prior to COVID. We would have these 4-week programs for caregivers where caregivers would come together in a smaller group, and we would really teach loads of tools, strategies, techniques to help sort of navigate challenging situations, teach communication skills, learn new ways to navigate as you're dealing with a change in the process of dealing with dementia, and really building a support system too. And I'm excited to say we're bringing these programs back. We're actually doing a study with WashU, trying to show or see if this intervention is an effective model for caregivers and if it truly helps them. So in March, we'll be bringing these groups back. So excited about that, and would love for any of you, if you're interested, to be a part. The third thing we offer are support groups. We offer those both online and via Zoom. And then afterwards, we always send out a newsletter inspired by what was discussed in that particular session. So whatever caregivers are talking about, we do research and find resources and tools for caregivers so they don't have to do the searching and they have it all in one place for themselves. And then the last thing we offer are improv sessions, which improvisation, if you're not really familiar with the word, it's really making stuff up as you go, but it's about bringing people together to connect, to be with other humans, and to laugh and really have moments of joy with one another. And we'll talk about all of these a little bit more in depth. So that's just a little overview of what Project Present offers. And just to kind of give some background, right? And right, we know dementia is not a normal part of aging, right? This is not normal for individuals. It is a disease process. And what we are aware of is that it can impair information processing, right? Memory of individuals, the way people think, behave, their judgment. And then ultimately, it really makes that independent living impossible. So this was an image that, kind of helps us understand. Sometimes we need these pictures to help us understand what might be going on in the brain in a more metaphorical sort of way. So we think of, all of our brains are these forests of trees that, these healthy trees that promote, there's oxygen, all these great things that are happening. But what we know is when someone is dealing with a brain disease, things are dying off. And so that full forest isn't as full as it was, which lends itself to those issues in perhaps memory, judgment, behavior, all the things that start changing is because the brain is changing. And I think it's good to understand that as we navigate, communicate, and connect with someone living with dementia or a type of brain disease. And I think what we see sometimes is there's a lot of inconsistency that can occur. One day an individual might be behaving one way and then the next very differently, or there's hour to hour. There's things that just keep changing. And as a caregiver, you're realizing that you are changing moment to moment. You're also learning that you are creative. So caregiving is a creative process. When you are caring for another human, you are creative. And I work with lots of folks, and I'll ask the question, how many of you feel that you're creative? And I'd love to ask you all. Unfortunately, I can't see everyone right now, but if you can kind of do a little nod, or you can answer in your head, or you can shout out whatever you want if you feel you're creative. Thumbs up. What do we got? Okay. So I think we got mixed, right? So some people are like, nope, not creative, right? And other people are like, double thumbs, right? And wherever you are, that's fine. But I want to stress that I believe there is creativity in each of us. And I know there's creativity in all of you. And so I have this pencil here to prove it. It's my experiment. And what I do with this pencil is I ask us all to think about, this pencil. It's a pencil. We know we write with it, right? But I'd love for you to look at this pencil and think about how you could turn it into anything else besides a pencil. So for example, I might look at this pencil and take it and turn it into a bow of a violin. Does anybody want to shout out or put in the chat something that they might turn this pencil into? Or you can just think it in your head.
We've got somebody says a hairpick, a drumstick, a ponytail holder, a conductor's baton, an arrow.
Perfect. Yes, absolutely. And I think this is what caregiving is all about. It's all about looking at a situation and sometimes really having to think outside the box and tap into that creativity that's within us. Because I think we start realizing that we can't handle every situation with just the pencil. Sometimes it has to turn into the hair pick, the conductor's wand, all of those other things. So we have to start realizing and understanding that we are creative and that we can use our creativity to be even more effective as we care for someone living with dementia. And even more than creativity, something that everyone is doing is they're using improvisation. So caregivers might not be aware, but on the daily, you are improvising, right? You are making stuff up as you go. You're figuring things out in the moment. And that's what improv really is. And so what I like to encourage and say to caregivers is that you're probably doing these things. And so we're going to give you kind of the understanding and skills and more tools so that you can continue doing those skills that you're doing. And applied improv means taking these guidelines and skills that are rooted in this practice of improvisation and applying them to our caregiving. And the first and the hardest is to get out of your head. I think for many caregivers, right, we become stuck up here. We have perhaps guilt, worry, frustrations, thinking about what just happened, thinking about what's going to happen. And we can really begin to get spiraling up there. We get in this worry loop and we can get stuck. And so I think the first step is to raise awareness when we are up in this land and say, is this serving me? And if it's not at that time, perhaps we can then change our focus. It's easier said than done, but I think the first step is raising the awareness, because when we're stuck up here, we're also not able to be as present and connected to the individuals that we're with. And successful communication and connection happens when we're really able to have that sort of presence and engagement. Be present in the moment that we have. And it makes a huge difference. I think we all probably are aware of when individuals are not present. They're not engaged with us. They're kind of doing something else. They're not giving us their full attention. And we tend not to have the same sort of successful connection with the person because of the disconnect, that inability. So we really want to think about raising our awareness to sometimes seeing, is this serving me in the moment? If not, let's put our presence, let's be present with the individual that we're with. And from there, we can actively listen. So really listening to what the person is offering you, what they're telling you. I think a lot of times we might listen to a wee bit and then we kind of go back up into our head. I mean, I know I do that, right? And start thinking of the next thing. So I think it's really trying to give that full attention. But I think we learn too, as dementia, as an individual's like brain disease progresses, we see that language changes. So perhaps the individual is no longer communicating in ways that are the same as they did. But what we can understand is that our nonverbal communication is a really powerful form of communication. In fact, 80%, approximately 80% of our communication is done nonverbally. And yet we really focus mostly on the blah, blah, like our words, what we're saying. And so I think it's really awesome to know that we can always communicate, because nonverbal communication is always there, right? Facial expression, tone, pace, rate, our body language, all of those things are expressing a lot to another person. So we can really read the nonverbals of someone to understand perhaps what they're going through, what they're feeling, what they might be thinking, as well as being aware of what we're offering in our nonverbals. So I think being aware of both verbals and nonverbals, and that we can really listen to both to fully understand someone is a real gift in terms of the communication process. And from there, the fourth guideline of applied improv is to yes and. So this is really the crux. This is the core of improvisation. And what it means is to accept and build. It doesn't mean agree, but it means really accepting what someone is offering you and then building from there. So if I was in an improv scene and I had a partner with me and they said, oh, I bought you this blue sweater. And I look at it and I say, that's not a blue sweater. Wah, wah, wah. I really killed the scene, didn't I? So my partner, who just offered me this gift, is now kind of like loses trust in me. I've really blocked them. I've shut them down, and we really go nowhere. And we see this happening kind of all the time when we care for someone. We block, we shut down, and we don't accept the reality of what they're offering us. So we want to think about reframing. A person with dementia is told no all the time. No, you can't drive anymore. No, you can't do that. No, you can't take that. No, you have to. So there's a lot of no's. And yes, and is a tool that we can use to accept and build from where the person is. And I think we have a lot more success and harmony in the relationship. And we're gonna dive into yes and a bit more in a wee bit. our last guideline then is really to make others look good. So I think our focus is the integrity and well-being of other. And I think when we do that, we tend to feel better about ourselves, but also the person that you're caring for feels better about themselves. So it tends to be a very symbiotic relationship of making each other look good, having that best interest of other. So those are really the 5 guidelines of improvisation, like getting out of our head, giving that presence, really listening to both verbals and nonverbals, using yes and to accept and build, and making others look good. And those guidelines have some goals. What we hope that they can do is really help folks foster flexibility to learn to, like, maybe go with the flow and give up a bit of control. And let me tell you, I'm in the world of improv, but I love control, right? I love my agenda, my plan. I like to, have my list and just have things go the way I want. And it's like, when they don't, we don't like that normally. We like our plans. And I want us to realize that that's not going to be successful when we're caring. A story about a caregiver I've worked with, she and her husband, they would go to the gym regularly. And then he started deciding, he was living with dementia, that he wanted to dress up every day to go to the gym. And she did not like that idea. She's like, no, you cannot dress up to go to the gym. And he argued, yes, he had to dress up. And so what happens, right? But a conflict ensues. And this happened. And then they stopped going to the gym. So she realized that, was that worth it? Right? So he ended up going to the gym and he was dressed up, and she kind of let that go. I mean, and he looked great at the gym. So I think what we can realize, there's opportunities to learn to go with the flow and have a little bit more flexibility in how we navigate situations, because a lot of it's rooted in some of the stuff that we're thinking, perceiving, fearing, worrying about. And then we want to think about using improv to really be able to problem solve through our creativity and yes and brainstorming. So we use this idea of yes and because yes and allows us to sort of take risks and not shut ourselves down. We come up with more ideas. I have caregivers that will do this together or by themselves, where you basically just say yes and. If you're trying to solve a problem, your loved one isn't taking his medicine anymore, so how can we try to come up with a solution to that? And so you don't block out any ideas, and you just kind of say, and you can do, like I said, with someone or by yourself, just allow any idea. There's no wrong idea to come out, and just yes and blah, blah, yes and we could dance, yes and, there might be loads of ideas that come out. And then later you can dissect those ideas and realize, well, that's not going to work, or that's not going to work. But you might have come up with some gems in there that you would not have come up with if you limited yourself in your thinking. So we use yes and to really help brainstorm and navigate sort of different problems and coming up with creative, sort of innovative solutions. And all the while kind of remembering, by practicing these guidelines and skills, that our mood and our attitude really are contagious. I think that's where the breathing comes in. That's where using these guidelines come in, because I know when I'm in a mood, right, that mood can be felt by others. So I have to recognize that and be aware of my own being, so that I can make sure that my mood and attitude are at the place I want them to be. Now, saying all of that, I realize it's impossible, right? We can't always be doing all of these things perfectly at all. We're human and we're going to make loads of mistakes, but it's just about having these tools and strategies that we make a mistake, we pull out another tool, we try again, because we're doing the best that we can. And that's why you all are here today, because you're just trying to learn and get a skill or two or strategy that you can take with you. So let's give ourselves that compassion as we move through and as we are caregiving. So some simple sort of communication skills that we can kind of break down, some more tools for the tool belt. I think the first one we want to think about is slowing down. And that's can be very challenging because we're busy people. There's lots of things going on, lots we have to do. But usually messaging isn't conveyed as effectively if I'm running from the kitchen over into the living room and I'm telling you that you need to go, we're going to go to the store, then we're going to a doctor's appointment, and I'm speaking quickly, right? The message won't land as effectively as if we're able to really slow down and be specific and keep our message simple. So I like to over explain things and give all the details and tell all the things that, but I think we can realize that we can probably cut out a lot of information and keep our message specific and simple. And that is going to land and be more effective at communicating. As well as that is the way we communicate. If we can make eye contact, if we can be speaking and gesturing face to face rather than yelling in from the kitchen, it's if we can be at the same level, even not standing above someone looking down, but really looking at the person at that same level. Maybe you're both sitting down facing each other so you can communicate and share the message that you want to communicate. And then we recognize that a form of communication is simple touch. So sometimes we can get rid of words and we can use touch as a way of communication, a way of comforting, validating, making someone feel safe, making someone feel loved, whatever it might be. So, knowing that touch is a really important form of communication, and we oftentimes see that changing for an individual. And so recognizing that it is a way we can continue to communicate, making sure, you're comfortable with however it is you want to explore that with the person that you're caring for. And then mindful of our environment. I think that's key because environment can really shape the way communication and connection changes. And you might not even be really aware of what could affect someone. Sometimes there's an odor that might have a trigger, right? Because we know sensory issues start changing as someone progresses with dementia. There might be a flickering light, right? The TV's on and it's really loud. Maybe the grandkids are over and they're screaming. There's just some changes in the environment, or you're in a brand new environment. So I think that awareness of where we are also shapes how someone feels, how someone's able to connect, communicate. And so just that awareness is really going to help us. And then I think it's important to understand that the processing time of a person living with dementia also can change. And I don't think we take that as much into account. I think we can think about maybe those trees back at the beginning when I showed that. And I think that example of, the trees changing, that shows also that your processing time of an individual is going to change as well. And I do this exercise to do it with you all right now, just to give us all this sense of what a change in processing time can be. So right now, I'd love for you all to imagine that you are a person living with dementia, and I am going to ask you to do something. And then I'm going to start my timer here. I'm going to put it on, and we're going to see and feel what a minute of processing would feel like. So are you ready? All right, so I'm going to ask you to please go get your coat. So that was a minute. Uh, I don't know, if you're like me, I I I know I wouldn't be able to sit there a minute after giving that direction. I would probably actually do this. I'd be like, go get your coat. It's the one in the front closet. It's blue. It's got the zipper. Just go get that on because we're leaving. So what I'd probably do is give a set of directions that added a lot more to it. And then, though, guess what? What I've done is I've then provided a whole new, set of directions with a lot more information that then causes the individual have to kind of start all over processing all of that. I don't think we realize the simple act for many of you, go get on your coat, right? You probably did 14 things while I waited that minute, but the simple act of getting on a coat is broken down into so many pieces. Thinking about if the person's sitting in a chair, how do I get up out of my chair? Which way do I turn? Even just movement in general, like walking. Where is my coat? What is my coat? Opening up a door, putting it on. We break that down and we see that there's loads of steps that take place in one simple direction. And so we really want to be aware that that processing time changes. So that's why we think about slowing down, specificity, keeping things simple, but also probably finding other ways of then if messaging is taking longer to process to help the individual. Because there's, I'm sure, some folks that have maybe the patience and minutes that they will just listen, and that is awesome. But a lot of folks, we probably won't go there. And so we can find other ways. I think one thing you can do, though, if you want to repeat the direction, just repeat it the exact same way so that the individual is getting the exact same message. So it's not being a new set of directions that they have to process. It's the exact same, please get on your coat. But I think another valuable way to think about navigating this is to mirror the desired outcome. And we can use mirroring for all sorts of different things. So you probably could go with the individual and stand up together, walk to the door where the coat is, open, get out both coats, and then you can mirror the desired outcome. So the individual is receiving not only the verbal cue, but they have a visual cue that you are doing the same act so they can mirror the desired outcome. And we see this happening. We can use this in lots of situations. For example, individuals take medicine together so they can mirror that so that we're doing it together, putting on clothes, perhaps, brushing teeth, really any sort of activity that you're really trying to achieve. Mirroring can be a way to help individuals achieve that desired outcome. So, if we don't have the patience, and not even patience, it's the reality of the time and energy it spends, but understanding, and I think having that empathy and understanding processing is going to be a huge gift in understanding how you navigate and communicate with an individual. Uh, and then we can think about just going back to our nonverbal communication and what we call an improv gibberish, because we do know that as individuals progress with Alzheimer's disease or some related dementias, their language changes. Sometimes it's difficult to understand someone. They might begin speaking their own language, like I said, gibberish. And so we need to rely on other ways to communicate. And nonverbal is, I think, a tool that we can use. I worked with a caregiver and his wife, she became fully fluent in gibberish. So she spoke her own language. And I remember he came back to the group and he said to us, like, communication's over. I can't talk to my wife anymore. And that's a very hard thing to navigate. But what we realized is his wife was still really communicating. So she would be like, she had her own language and loads of emotions and feelings that were associated with it. And so he started learning that he just needed to really watch his wife, because it was pretty clear when she was like, that he could say, I see that you're sad. I'm sorry you're sad, or hold her hand. So he could read what she was offering through her tone, her pace, her expression. And really, when you think about it, we all want to feel valued and heard. So simply being able at times to say that to someone, I see that you're this, I'm sorry you're this, or wow, you're so excited, just to be able to read what someone's offering you is a powerful form of connection with that person. It enables them to feel valued and heard. And I can't discredit it enough. I think it's just a valuable tool that we can all use, and recognize that, language does change, but we can still really be able to connect and communicate with someone and enable them to feel valued and heard. I also have worked with other folks that full on, they will speak gibberish back and forth. So, there's always a spectrum with everything, and everyone has different comfort levels. I think a place that we can all be is really trying to see the nonverbals and understand and be able to read what they're offering us. And then there's the other side where you might be back and forth like, so there's no wrong right way, but these are tools and strategies that can help form and forge that connection with one another. So nonverbal communication is key. Also, being aware of our own, and sometimes that's the thing we're most clueless about, right, is what we're offering and sharing with our nonverbals. Like, earlier I got that blue sweater in that improv scene, but I could be like, oh, I like that blue sweater. You know, I said I like that blue sweater, but I have to be aware, because people do sense our nonverbals, how we are communicating with our tone, with our face, our body. So how we say things and what we're doing in our delivery, it can really change how we connect with an individual. All right. I promise you we'd get back to this yes and. And so here we are. So yes and, like I said, is really about learning how to accept and build. And this is really about accepting the reality of the individual. And I think sometimes that can be difficult for individuals, because maybe you've been married to this person for over 40 years, and you feel by accepting their reality, you're kind of lying because it's not really the truth. And so, or it's my parent and I don't want to like be in, that seems weird for me to say that what they're saying is right because it seems wrong. And I totally understand that. But I like to encourage people to think about it a little differently, that what the individual is experiencing, feeling, seeing is their truth, is their reality. We go back to that brain and think of that picture. Their brain has changed and their reality has changed as well at times. So being able to accept the reality of the individual and build from there will lend itself to less conflict, less stress, that we can, with our fully cognitive working brains, accept where this person is and build in a more harmonious way, because it is their truth and it is their reality. So I want to illustrate that with some examples, because I know it's like, huh, what do you mean? So first example I can share is a caregiver that I worked with, her and her husband. Her husband was living with Alzheimer's, and every night he was on the beaches of Alabama. And every night she was like, no, we're not. We're in our living room. There's our TV. You're on the couch, right? So she would just let him know where they were. And I get it. Like there's something called like reality orientation, like bringing them back. And it's a comfort to have that reality, but not a comfort to the person living with dementia, and ultimately not a comfort to the caregiver, because we see conflict, because the husband was like, no, we're on the beaches of Alabama. No, we're not, right? So we see this conflict ensue, and it just added stress. One night, she yes-anded the beaches. So she was like, yes, we're on the beaches, and the sand is so warm. And her husband was like right there with her, and they were on these beaches, and it was It was lovely. That. So yes, and so yes, that sounds like an easier thing to yes and. So then I've learned so much through caregivers asking questions. So from that, actually last week I was giving a presentation. I had a caregiver raise her hand. She's like, I'm really not a yes and type person. I wouldn't go to that beach. I couldn't do that. And I was like, well, great. I think this goes back to the spectrum. So maybe you're not that yes and person and you don't want to go all the way to the beach. But what you could try is just yes anding beaches, right? Because by blocking the reality, by telling the husband, no, you're not on a beach, you are going to have conflict. But if you perhaps go to the other side of the spectrum and say, oh yeah, I love beaches. And I remember as a kid, I loved building sandcastles. So maybe just entering the world, if that's more comfortable for you, that's another way of really using yes and accepting the reality that the person's offering rather than blocking it, rather than telling them their truth is not, because that is what they're feeling. So that's kind of just thinking of it as a spectrum of where you feel you can enter. Um, from there, this was another presentation. I had a caregiver ask a question. She was also about the beaches because she's like, well, yeah, she was the opposite side. She's like, I could totally yes and the beaches. That sounds lovely. But my mom has horrible hallucinations. She sees horrible things. Am I supposed to yes and that? And I said yes, but I'll explain what I mean. So this woman having hallucinations, that is the truth. That is what she is seeing. And for you to come in, right, and say nothing's, I mean, I think my first instinct, if that was my mom, would be, there's nothing there, mom, don't worry, there's nothing there. But for my mom, for this particular woman, she was seeing something there. Something was terrifying her. And so to say that it's not is not really showing her that you're understanding, validating, and supporting her, because her truth, her reality in that moment is something terrifying is happening. So what we can do is yes and the emotion. Yes, I know you're terrified and I'm here. Yes, I know this is really scary and it's going to be okay. So I think we can, yes, and the situation, yes, and the emotional impact that this is having on the mother, and build through that so that we are showing that we accept what she is feeling, what she is experiencing, and building from there, but also showing that support. So I think ultimately we can think about questions to ask ourselves is that a lot of times things are rooted in really, is the individual feeling safe, secure, valued, or heard? And I think when we ask ourselves that, we often have to play detective to see what is going on. Maybe they are, maybe they're sick, maybe they're in pain, maybe they haven't eaten, maybe they have a UTI, maybe they haven't drank anything, they're really thirsty. You just never know. So we really have to kind of see what's going on in the situation and see if those needs can be met. And if not, just let the person know that they're safe, secure, and allow them to feel valued and heard. Because I think these are pieces that are really important. We all want to feel safe and we all want to be valued and have meaning and purpose. So I think that's a really valuable way. Trying to find that for individuals as well can be another key piece. And throughout all this, I think it's realizing that, as we're caring for someone, they look the same, they smell the same, all of these things are the same, but there's many differences occurring. And sometimes we have to be aware, because I see that what can happen is, people start mixing the disease and the person and feel like these are conscious choices, or the person is choosing to do because it's so inconsistent. How can 1 minute this and the next minute that? So I think really realizing that the disease, the things, these behaviors and things are the disease and not the person, and navigate and deal with the individual, knowing that they're not one and the same. All right. So we're going to transition here into a little bit of an understanding about just improvisation in general. So the improvisation is, the root of a lot of the work that we do. And one of the things that we offer are improv sessions for individuals. And we really bring people together. And how a session works is we've got people coming together. We do a warm up. We always breathe. So just like you all today, we always do a breathing exercise, a vocal, as well as physical. And then we move into some nonverbal exercises. And then we move into verbal. And then we always end with these imaginary presents that everyone gets. But the goal is to really bring people together to connect. And what we've learned, this is for caregivers as well as for people living with Alzheimer's disease or related dementias. And even if you don't want to do an improv session, I want us to think about these improv skills and how they can just be applied in our daily life to kind of take care of ourselves as well as taking care of the loved ones that we are caring for. So why improv? We started improv because we were seeing, specifically, we were focused on individuals living with dementia, seeing that there were depression, folks were getting depressed, especially in those early stages, a lot of isolation, being alone, and then just feeling inadequate. Like I mentioned, there's being told no all the time, things being taken away, not remembering, there's a lot of things that start changing. But we later recognized that this is also happening for caregivers. They're dealing with caregiver burden, there's depression. They tend to sometimes isolate if they don't have support, feeling like they're not necessarily doing things right. So we wanted to give a place where people could sort of feel the opposite, and realizing that improv could be like an antidote, right? Not literally, but that it can help, because coming together in these settings, allowing people that there are no mistakes. So everything that everyone says is brilliant. We yes and everything. So we accept and build on everyone's ideas, and memory is not important. So for someone that's living with, that has a memory changes going on, it doesn't matter because it's all about the present moment, right? And so we really want people to allow them to just feel good for the mind, the body, and the soul. And it's building connection and social support. So we have people coming together. That's the most important thing. We need people to come together and be with other humans. That is valuable. If you do have a brain disease, if you don't have one, if any human needs other humans, and this is so important, as well as laughing. And that's one of the number one goals, is for folks just to laugh. We don't laugh enough, so we need to find these opportunities to allow ourselves to laugh. And it's just a drug-free approach to improving mood. We've been doing for years, we have this little, I don't know if you can see, it's a little smiley face scale. And when people come to a session beforehand, they circle or tell us what they're feeling, and then after. And we see, by and large, an improvement in mood. So people come in feeling one way and they leave feeling a different way. And I think that's really powerful, that individuals say, well, my loved one doesn't even remember it. But guess what? That doesn't even matter, because if the mood and the feeling stays, that's what counts. If we keep that positive mood, that good energy for as long as possible, then obviously that helps continue the rest of the day in a more positive place. So, like I said, you might not come to an improv session, and that's fine. But I want us to think about how some of these approaches and how some of these practices can, I think, really benefit the dyad and really benefit the caregiving partnership, giving you some grace, some compassion, some laughter, and some joy. So, my friends, we are going to just take a moment to all take in a very deep breath, and then we're all on mute, so just loud sigh it out. Let it go. So nice deep breath in, loud sigh out. Let's do one more of those. Nice deep breath in, loud sigh out. Thank you. Thank you so much. We are going to open it up for questions. I also have a very, very short survey. So this has been generously supported by the Marillac Mission Fund. So there's a link here, and I think we could probably share it in other ways as well. But I would be very grateful for if you could fill that out at your convenience. And oh, there goes my dog at the very end here. But I'd love to, yes, open it up for any questions that folks have. And maybe if we could put that link into the chat, that might be helpful too. So if
So
people can,
I can't grab it off the screen. Can you copy and paste that over into the chat?
Yeah,
oh,
same.
oh,
Yeah.
yeah. You know what? I will have to.
And then, so if you want, you can, oh, it looks like
I
you're
will. I
getting
will
it.
grab. I will grab that and then share that.
Perfect.
Sorry. Yeah.
Excellent. Excellent. That sounds great. Well, fantastic. This is just very applicable, and it's, wonderful to have these specific and concrete tools that are, philosophical in terms of how we think and changing how we approach situations, which is so important. We do have some questions already starting to come in. One of them, and this might be, a little tricky, because it's more of a clinical question, but how do you know when it's altered mental status from infection or a dementia hallucination? For example, someone shared, her mother was catching fairies and it was an infection.
Yes. I mean, I think you could. I mean, I am not a doctor, so I could not help out with any sort of diagnoses or anything like that. But I think probably we can navigate situations very similarly because we use this with different populations. Because probably even if she's catching fairies and it's, induced by an infection, it's still the truth or reality that she's dealing with at that moment. I imagine if you tell her no, that's probably going to cause more conflict as well. So I think we can use this yes and in lots of different sort of scenario situations. And I think that could probably be applied there just as well.
Abs- Absolutely. And I think there's some, valuable feedback going in. For example, check temperature and vital signs, check urine for cloudiness, treat mental health the same way. And definitely, we know that dementia can, especially dementia with Lewy bodies, can have hallucinations or fluctuations, which, are kind of something that pops up and reoccurs throughout the disease. But with infections, usually that's more of a quick kind of onset, a sudden change in status. And so I would say if that's something that you're noticing all of a sudden, definitely consider partnering with, the temperature, checking urine, keeping an eye and touching base with a physician. Oh, good. And there was other feedback, a big dramatic change from baseline. So all very good advice. So we have here, how do you motivate a parent who is depressed about her state of living to exercise to loosen up any stiffness?
Yeah, that's a good one, and that's very common, right? It seems to be like sometimes a tendency for less and less activity, right? So that could be one where we talked about the mirroring. Sometimes it's the buddy system we see works. This is another thing. There's no one answer. So I tend to, with people, like kind of just brainstorm lots of ideas. It's valuable to get to know the individual. So if your mother is someone that, loved going to the gym with friends, it's about finding these opportunities that are connected to some of perhaps things that she enjoyed. If she loved, doing yoga, maybe finding some of those things that were interests of her and bringing those back. There are also, I've had a lot of folks do online, pulling things up on the TV, doing it with, I think it's valuable. And I know people don't always have the time, but if you could do those together, that can be a value. A lot of folks I've been working with lately have been using an organization, I guess doing a plug for them, they're PT Mobile. And so there's physical therapy that comes to the home. And it has been, because sometimes it's also you, right? that someone might not want to necessarily do what you're telling them, but if we bring in someone else, it can be really valuable. But I've had a lot of folks find bringing in this physical therapy, and it's specified for older adults, and they work specifically, have a huge group with Alzheimer's or different dementias. So that I know has served folks, sometimes associating or having exercise and then maybe with some sort of treat benefit that then goes with it, right? That makes it like, oh, I exercise in the end, we do this. So that is something that brings your mom joy. So those are, I'm just kind of brainstorming some different ideas that can sometimes work for folks.
Excellent. One of the things that really sticks out to me in terms of your work is just that idea of living and stepping into their reality, because we know that logic and reasoning are not necessarily our friends anymore when it comes to that. And I'm wondering if there's any key points that stick out to our guests today, something that maybe was surprising for you or something that it has challenged you to think about in a new way. And you're welcome to come off mute if you'd like to share that or type into the chat. But we'd love to hear a little bit from you. And while folks are doing that, we do have a question from John that says, if memory is still okay with some prompting, do you feel there's value for a structured connection facilitated by a caregiver to recall a work history or contributions to family, church, community, city, state, or nation?
So let me get that one more time. Sorry, if memory, I
Yep.
can flip the chat myself. If memory,
Yeah.
okay, so do you feel there's value for a structured connection facilitated? To make by a care to recall a work history. I guess I'm just curious, like a structured, I was just curious what that might mean. I don't know if that means like almost like quizzing the person about their past. Is that?
That's what I was wondering. I wonder if he's kind of trying to suss out the difference between reminiscence, which could be positive, versus quizzing, which we know is negative.
Yeah, I think we know like talking about, earlier events in life, especially long memories, right? Those tend to stay with individuals. It's the short-term memory that we see going first. So I think those long-term memories, discussing those, bringing those up can be of real value. I think without being like, do you remember? Right? We don't want to like, yeah, quiz the person or put it on them, but perhaps sometimes just like photo albums of past is a great way to recall and go through individuals' history and life experience. If you have any sort of, books, memories, keepsakes, I think those are great tools to use without putting pressure on person to like answer questions or recall, because I think just the images and things would be really helpful. Yeah, I
Excellent.
don't know if I answered that in the way I'm sorry, John, if that was. Oh, okay. I see you, John. Great.
Excellent. So I just put a little note in the chat. What are some suggestions from today that stuck out to you, our guests today? Feel free to share those. I wonder if we have any other questions. You're welcome to come off mute and ask that or throw it in the chat. We have one from Andre that says she liked the section of the suggestion of don't block, which is outstanding. Good. Excellent. I don't know if everybody's quiet because they're hungry for lunch or because you covered it so perfectly. So Dottie mentioned really appreciating that 60-second pause. And I think it was really illustrative just to feel how long 60 seconds of processing time really is. Excellent.
And I do want to say, like, if you don't have any questions now, that's perfectly fine. But please feel free to reach out if like you leave and then you're like, well, wait a minute, and you have a bunch of questions. Please get connected. I am happy to talk with you one-on-one, because I know everyone has different situations, and that's what we know. It's not just one path. So please reach out. I'm happy, like I said, to answer any questions or get connected with you. And also just our services are free, so you know that. So reach out too if you want to join or be a part of any of the services. In fact, that's what that if I can, I'm going to let you all talk. I'm going to try to grab that so that I can share.
Excellent. Thank you for that.
Yeah.
And while you do that, we have some feedback that, being present and yes are real valuable. And then 2 comments from individuals, very informative and innovative work. Thank you. You've given us a lot of insight and very valuable transfer of your expertise. So fantastic. And then you're welcome to put that link in the chat. We would appreciate if anybody would just help us evaluate the program. As you know, grant funding is always dependent on ongoing feedback and showing that the work has benefit. So your 30 seconds or more, a little bit more of time can definitely help continue this work moving forward. So
And it's in there. So thank you. Yes. So I know it can be complicated to navigate, but hopefully if you just copy that and you can paste it in a link, it should come up. If not, we tried, right? We tried.
absolutely. I clicked on it, it came right up. So
Oh,
hopefully everybody can do that and it'll
okay.
open up in your browser. Oh, and we do have another piece of feedback to come in and share while folks are doing that. Deanne shares her husband is still where he knows he should be able to do something and can't, and he gets so frustrated and feels inadequate. I'm really having a hard time on how to make him feel better about himself and his self-worth. He has motor issues as well, so simple tasks are difficult.
Yeah. Yeah, I think it can be very challenging for folks, right? That especially that awareness of their losses and what's going on. I think, working with caregivers, it's, providing a lot of sort of compassion and support in those situations. Like it's okay that these things are happening. Also, then really trying to then use our yes and brainstorming and finding ways that the person that could have more perhaps success. So maybe the person is great at giving advice. Maybe you come up, so just finding different ways to give purpose and meaning to an individual, which might be within their realm, their ability levels. And so I always try to get caregivers to make a list and come up with ideas of how can I give this person meaning and purpose? And it can be really a wide range of things, but trying to help that person feel fulfilled. So I would say if you could kind of brainstorm that might be helpful just to find that way to give more purpose and meaning when someone's feeling that lack of.
Mhm. Absolutely. Wonderful. Well, thank you to everybody for joining us today. Thank you to Anne Marie for your presentation and for your work in this area of new ways to bring dignity and communication and connection to individuals who are affected by memory loss and their care partners. So we're very grateful. So from everyone here, from our friends at Kingsland Walk, thank you so much. And we hope to see everyone again soon.